Good evening. State health officials have confirmed 9 new measles cases in the upstate. Brings the total number statewide this year to 156. And they are warning those who have been exposed should not break quarantine. Ripley Simone has more on the story.
Any one case that goes out in public and is potentially spreading before they recognize that they could be infected with measles remains a concern and is one of the reasons that we continue to have some of these public exposures.
State epidemiologist Dr. Linda Bell details what's at stake if people break quarantine. She says 249 people are in quarantine and 7 are in isolation after the newest cases of measles have been reported. The Department of Public Health reported 9 new measles cases, with 153 of them related to the upstate outbreak. Dr. Bell says due to the holiday break, there are no new exposures from school settings, although 2 of the new cases are from a previous school exposure. 5 of the new reports come from known household exposures, and the source of one other is unknown. A second is being investigated.
Of our 153 outbreak-related cases whose vaccination status is known, about 95% are unvaccinated. And this speaks to the benefit that vaccination brings as being a highly effective way to protect people against measles.
She says the measles, mumps, rubella vaccine has been shown to provide lifelong protection for about 97% of those who complete the recommended 2-dose series.
So if people become ill while in quarantine, regardless of the nature of the illness, they should notify a healthcare provider of their exposure to measles before seeking care, so that facilities can take measures to prevent possible exposures to others in healthcare settings.
Dr. Bell says this is also a good time to get a flu shot. The state reported its first flu-related death in early December.
Now that the disease is surging in our state, it takes about 2 weeks for your body to mount a full immune response to get that protection. Exposure is unpredictable, so just like we're recommending with the measles, we ask people to consider getting protected as soon as possible because you don't know when you might be exposed.
Vaccines for measles and flu are available at many primary care providers, offices, pharmacies, and DPH health departments. In Spartanburg, Ripley Simone, 7 News.
Dr. Bell said the time frame for those in quarantine for measles has been extended. The last quarantine date now falls in the middle of January.